Hi everyone, my name is Kelly Donellan and today I'll be showing some various palpations on my client for the day. This is my brother Aiden.
Hello.
We're going to be showing various palpations. I will start by palpating the inferior angle of the scapula. So in order to find the inferior angle, you're going to start by having your patient sit up straight. And right here will be the area of the scapula. The inferior angle will lie in between the medial border of the scapula and the lateral border of the scapula. And it will be roughly right down here. So if you follow the medial border of your patient's scapula down to around the level of the T7 vertebrae, right near the 7th rib, that will be where your inferior angle of the scapula is. So in order to make this more prominent, you can have your patient touch their opposite scapula with this arm. And then right here it will pop out a little bit more. And you will see that if you follow the medial border down of the scapula, right underneath this pop out part will be the inferior angle of the scapula. Right here, this angle around the level of T7 vertebrae. And then following this up, if you circle around, that will be the lateral border. So right in between the medial and lateral borders, this prominence will be the inferior angle of the scapula. Next, I'm going to find the acromion process of the scapula, which can easily be found by following the clavicle. So by starting here at the sternal end of the clavicle, you can walk across the body of the clavicle all the way to the acromial end of the clavicle. And then the acromion process is just lateral and slightly inferior to the acromial end of the clavicle. And right here you can feel this bony prominence is the acromion process. So at the acromial end of the clavicle, just lateral and slightly inferior, you can feel that acromion process of his scapula. Next, I will be palpating the landmarks on the distal humerus, specifically the medial and lateral epicondyles of the humerus, which can be seen as two bony prominences on the medial and lateral sides of the distal humerus. So on this side, we have the medial epicondyle, this bony prominence, and on the lateral side, the lateral epicondyle, which can be seen in both flexion and extension can be felt and palpated. And these are the two prominences, the medial and lateral epicondyles of the distal humerus. Next, we will palpate the olecranon process, which is a landmark of the proximal forearm and can be seen on the posterior border of the ulna. Right here is a bony prominence, and it can be seen in both flexion and extension. And along with the medial and lateral epicondyles, the olecranon makes somewhat of an equilateral triangle with the medial and lateral epicondyles here. And here's the olecranon process of the ulna in flexion, and again the bony prominence in extension. It can easily be palpated. Next, we're going to find and palpate the head of the radius. The radius is a bone of the forearm, and the head is located proximal on the proximal forearm. So we're going to start by finding the lateral epicondyle of the humerus, which we have previously palpated, and we're going to move slightly distally to the lateral epicondyle. You will notice a little dip in between your fingers, and that dip, follow that dip distally until you find another prominence, and the second prominence will be the head of the radius. So you can actually see the head of the radius and feel it gliding by starting your client in supination and moving to pronation. We will feel the head of the radius gliding beneath our fingers. Back to supination, and we will have the head of the radius, which is right here, slightly distally to the lateral epicondyle. Next, we will find the head of the ulna, which is located on the dorsal aspect of the wrist. If you follow the pinky down on the medial side of the wrist, you'll find this bony prominence in the distal end of the ulna, which is the ulnar head, which can also be seen slightly better in radial deviation. And right here, this bony prominence is the head of the ulna. I will now palpate my client's radial styloid. And I will start by locating the anatomical snuff box and have my client put his thumb in extension so I can easily identify the posterior and anterior borders of this anatomical snuff box. Then I will gently palpate within this space on the floor of the anatomical snuff box, where I will find a bony prominence or horn, and this is the radial styloid. So in between the posterior and anterior borders of the anatomical snuff box, palpated on the floor of this snuff box, I can feel the bony prominence, which is the radial styloid. Now I'll find my client's brachial pulse, which will be located in the groove in between the biceps and the triceps muscle. So I will start by first locating my client's bicep muscle and more posteriorly the triceps muscle and find the groove in between these two muscles. And then I will take my index and my middle finger along this groove medially and push in towards the humerus. And in this groove, I can nicely find my client's brachial pulse. The second pulse we will be locating is the radial pulse. So we will start by finding the client's anatomical snuff box, which we can see right here, as that is where the radial artery will travel through to find the radial pulse. And then anterolaterally to that, we will locate the first dorsal compartment of the wrist and flexor carpi radialis. And right in between that, using two fingers, making sure to not use the thumb, as our thumb has its own pulse. Right there anterolaterally, we should be able to feel our client's radial pulse. I will now palpate my client's iliac crest. Starting at the level of the abdomen, on the lateral part of the trunk, I will push inward and downward gently and can easily feel the iliac crest. So right at the level of the abdomen, on the lateral side of the trunk, push slightly inward and downward to palpate my client's iliac crest. Beginning once again at the iliac crest, the shelf of the iliac crest, I will now try and palpate the anterior superior iliac spine. So by starting at the iliac crest, the shelf of the iliac crest, I will walk my fingers anteriorly until I find a bony prominence right about here, which will be the ASIS, also known as the anterior superior iliac spine. So starting at the shelf of the iliac crest and walking anteriorly to find that bony prominence, which is the anterior superior iliac spine. I will now be palpating the greater trochanter of my client. In order to do so, we will put the client in prone position. We will start around the mid-thigh area and using the palm, palpate up the thigh. We'll do so until we feel a bony prominence, which should be the greater trochanter. In order to ensure this is the greater trochanter, we can flex my client's knee, put 2 to 3 fingers on this area, and internally and externally rotate the hip. And I can feel the bony prominence of the greater trochanter move underneath my fingers. Next, I'm going to palpate the medial and lateral femoral condyles of the femur on my client. So we're going to start by having our client flex the knee. And we're going to take our hands about mid-thigh on either side and walk down the mid-thigh to around the area of the knee until we hit these 2 bony prominences on either side. This side on the lateral side being the lateral femoral condyle, and on this side medially, the medial femoral condyle. So following from mid-thigh down the area of the femur to the area of the knee until we hit these 2 bony prominences, the lateral and medial femoral condyles. I will now be palpating landmarks of the proximal leg, starting with the tibial tuberosity. I have my patient once again in supine position, where I will have him flex the knee, and I will locate the medial and lateral femoral condyles that were previously palpated. Then, traveling anteriorly and walking down with my fingers, I will palpate the patella. Just inferior to the patella, there will be a bony prominence. This is known as the tibial tuberosity. So after palpating and finding the patella, travel inferiorly until I hit this bony prominence, which is the tibial tuberosity. I will now be palpating the fibular head, beginning once again on the tibial tuberosity that was just palpated, this bony prominence. I will walk my fingers laterally till I find another bony prominence, which is the fibular head, or the head of the fibula. Now it's important to be careful around this area because the common fibular nerve wraps around the fibular head. So when palpating this area, walking from the tibial tuberosity laterally to the head of the fibula, it's important to be gentle because the common fibular nerve does wrap around this area. Now I will palpate landmarks of the distal leg, specifically the medial and lateral malleoli. So I will start by coming down the shaft of the tibia, coming inferiorly down the shaft of the tibia. I will find these two bony prominences on either side. One on the lateral side, which will be the lateral malleolus, and one on the medial side, which is the medial malleolus. So we have one bony prominence here and one on the other side medially. You can see the medial malleolus on this other ankle. So we have the medial and lateral malleoli. Next, I'll be palpating my client's posterior tibial pulse. So if you follow the tibia down to the medial malleolus, which is previously palpated right over here, the posterior tibial pulse will be located slightly posteriorly on the posterior border of the medial malleolus and the medial border of the calcaneal tendon. It can be seen felt slightly better if we invert the ankle. And right here posteriorly, I can feel my client's posterior tibial pulse. I will now find the dorsalis pedis pulse of my client, which can easily be palpated over the dorsum of the foot. You follow the line from the extensor retinaculum, just lateral to the extensor hallucis longus. Right here you can see the extensor hallucis longus tendon. So just lateral to that, I can find the pulse, the dorsal pedis pulse of my client.